Welcome to the program entitled General Guidelines for Patients with Passive Implants to Facilitate MRI Screening. Since 1986, my colleagues and I have tested thousands of passive as well as active implants using MR systems operating at static magnetic field strengths ranging from 0.2 up to and including a Tesla. As such, I believe that I have a unique perspective when it comes to performing MRI exams in patients with all types of medical implants. I hope that by the end of my presentation, you will gain the knowledge and confidence to safely manage patients with certain passive implants that have general guidelines created to facilitate and simplify screening. Medical implants and devices are commonly divided into two main categories, passive and active implants. A passive implant serves its function without supply of electrical energy or any source of power other than that directly generated by the human body or gravity. Examples of passive implants include heart valve prostheses, orthopedic implants, and programmable CSF shunt valves. Please note that my presentation specifically refers to passive implants only. The standard policy that implant labeling is required before allowing an MRI exam in a patient greatly limits access to this vital diagnostic imaging modality when information is unavailable. Therefore, to facilitate patient screening, general labeling guidelines were developed for certain passive implants. These guidelines were based on the relevant peer-reviewed literature and other related documents, along with considering the primary safety concerns, namely magnetic field-related force and torque, as well as RF-induced heating for the implants. By following the MRI-related conditions, patients with certain unlabeled passive implants can benefit from the diagnostic information provided by magnetic resonance imaging. Importantly, to properly implement these general guidelines, they should be approved by the supervising physician of the MRI facility and adopted as written policies. Deviations from the conditions listed in the guidelines requires prior authorization by the supervising physician. Passive internal orthopedic implants are the largest metallic medical products that are implanted in individuals. These implants include nails, plates, rods, screws, wires, cranial closure systems, internal spinal fixation implants, sternal closure devices, disc replacements, as well as total or partial replacement implants that are used for the hips, knees, shoulders, and other joints. The general guidelines for this classification of medical products indicate that a patient with a passive internal orthopedic implant may undergo MRI using the following conditions: 3 Tesla or less. There is no restriction on the direction of the static magnetic field, and there is no restriction on the value of the spatial gradient magnetic field. For a passive internal orthopedic implant that is located inside of the area of the transmitted RF energy, use a whole body averaged specific absorption rate of 2 watts per kilogram, operating the MR system in the normal operating mode. For a passive internal orthopedic implant located entirely outside of the area of the transmitted RF energy, use a whole body averaged SAR of 4 watts per kilogram, operating the MR system in the first level controlled operating mode. The maximum imaging time is 15 minutes per pulse sequence, and multiple pulse sequences are allowed. Orthopedic implants that are excluded from these guidelines include external fixation systems, cervical fixation systems such as halo vests, traction devices, magnetically controlled or programmable implants like the MAGEX system, prosthetic limbs, and orthopedic prostheses with microprocessors. A vascular stent is an expandable tube-shaped device used to support and maintain flow through a narrowed or blocked blood vessel. Vascular stents may be bare metal, drug-eluting, or covered. Stent grafts that are used for the vascular system incorporate fabrics such as Dacron or Gore-Tex that are deployed within a vessel to reinforce or replace damaged tissue. The category of vascular stents includes all carotid artery stents, coronary artery stents, aortic aneurysm repair stent grafts, peripheral vascular stents, Intracranial diverting stents or flow diverting stents frequently used in combination with embolization coils, and similar stents intended for use in the vascular system. The general guidelines indicate that a patient with a vascular stent, including when there are 2 or more stents or 2 or more overlapping stents, may undergo MRI using the conditions similar to what I presented for the passive internal orthopedic implants. Patients with embolization coils used for cerebral aneurysms or arteriovenous malformations often require magnetic resonance imaging. Therefore, I developed general guidelines to facilitate screening for patients with these implants. The general guidelines have conditions comparable to the ones for passive internal orthopedic implants and vascular stents. Additional general guidelines are also available for heart valve prostheses, annuloplasty rings, and vascular access ports, which may be found on my website, mrisafety.com. For the heart valve prostheses, the information applies to all versions, including transcatheter aortic valve replacements or TAVRs, transcatheter heart valves, and other similar heart valve prostheses used during minimally invasive procedures. Note that these guidelines must be reviewed on an annual basis to confirm that no passive implants in the categories that I presented has become available that is labeled MR unsafe. Notably, there has never been an adverse event reported in association with performing MRI exams in patients with these passive implants that have general guidelines. You will notice that the general guidelines specifically indicate 3 Tesla or less, regardless of the direction of the static magnetic field or the value of the spatial gradient magnetic field. That means that the information applies to all MR systems with vertical or transverse field magnets, such as the 1.2 Tesla Oasis Velocity Scanner from Fujifilm. Regarding the spatial gradient magnetic field or spatial gradient field information presented in a passive implants labeling and its importance related to patient safety, here are some important points to consider. The spatial gradient field describes how the intensity of the magnetic field changes over distance. The deflection angle test is used to evaluate force acting on the implant. This test involves attaching the implant by a lightweight string to an inverted protractor, allowing it to move freely in space. The test apparatus is then positioned at the point of the highest patient-accessible spatial gradient field of the MR system, since this is the worst-case position of greatest attractive force that the patient with the implant will pass through when entering the bore of the scanner. The deflection angle is measured at that position. Thus, the spatial gradient field value indicated in an implant's labeling is where the force was measured. It is not a value that, if it was exceeded, would pose a risk to the patient with respect to the force acting on an implant. In virtually every case, once the metallic medical product is implanted, there are counterforces associated with the surrounding tissue by having some means of fixation, such as those associated with suture screws or other forms of securing the implant in place. These all contribute to a margin of safety with respect to force-related issues. What is often unappreciated by MRI healthcare professionals is that the spatial gradient field value assigned to an implant is not an absolute safety threshold. This is especially the case when one considers the previously mentioned counterforces that serve to effectively maintain the implant in place within the patient. And be aware that implants made from ferromagnetic materials that inherently exhibited high spatial gradient field values during testing were nevertheless approved to be labeled MR conditional by the U.S. Food and Drug Administration and other regulatory bodies. Therefore, if a spatial gradient field value is exceeded for a passive implant, there is no risk of injury relative to magnetic field related force as long as the level for the static magnetic field is followed in the MR conditional labeling. The spatial field gradient information that I presented was published in 2024 as an open access article in the Journal of Magnetic Resonance Imaging. Thank you for your time and attention to these general guidelines for patients with passive implants. I invite you to visit my website, MRIsafety.com, which is an online source of information pertaining to all aspects of MRI-related bioeffects, safety, and patient management.